Welcome to The Lens, hosted by Catalysis, where we get a glimpse inside healthcare organizations that are transforming to a culture of improvement to deliver continually higher value outcomes for patients, staff, and communities. Visit createvalue.org for more information about Catalysis.
Welcome back to The Lens. I'm your host, Peter Mariahazi. Joining me today as co-host is Catalysis CEO Carlos Schulz. Returning to The Lens is Paul Kempinski. Longtime listeners may remember Paul joined us on episode 24 talking about tiered huddles and problem solving at Children's Mercy in Kansas City, where he was CEO. Well, Paul recently retired from this role and is now, we're very excited to say, one of the Catalysis executive coaches. He recently wrote an article on the importance of coaching and mentorship for executives, reflecting on his 40 plus years of leadership in healthcare. Catalysis uses a transformation roadmap to guide organizations in their journey to organizational excellence. The roadmap includes steps from the board of directors all the way to support systems like finance and human resources. To see this roadmap, go to createvalue.org and look under the tab menu for organizations. Paul, thank you for coming back to The Lens. You know, it's been a while, so can you reintroduce yourself to the listeners and share about what you've been up to lately?
Yeah, well, first of all, Peter and Carlos, it's great to be with you both, and can't tell you how excited I am to be joining the Catalysis team as an executive coach. So thank you for that opportunity. Yeah, a lot going on in my life. As you pointed out, I just recently retired on February 1st after a 42-year career in healthcare leadership. And it was a remarkable career loaded with many learnings, many accomplishments that we achieved as teams, and the opportunity now to pay forward the learnings and the lessons that were accumulated over that period of time. So a lot going on in our personal lives. We're marrying off two of our three children this year. We are officially residents of Florida while we're still staying in the great city of Kansas City, Missouri. But from a professional standpoint, I started a small consulting practice that's really focused on executive coaching, governance and advisory services, and some public speaking. So the opportunity to work with Catalysis aligns beautifully with my plan to engage in this next chapter of my life and my career. So it's an absolute honor to be with you all.
Oh, marvelous, Paul. Thank you for sharing and congratulations on the weddings.
Thank you.
Paul, in your time, you've seen a lot of changes in healthcare leadership over your career. What are some of the aspects that had the greatest influence on you?
Yeah, I think as we all reflect back upon our careers, we can think about these milestone moments in time that ultimately are catalysts, pun intended, for how we respond as leaders to those situations. I think about when I entered healthcare leadership back in 1982, and at that point, DRG's TEFRA was passed in 83, I believe, and we went from this cost-based reimbursement system to this new scheme called diagnosis-related groups, which completely revolutionized the way that we were paid for healthcare services. So that was, impeccable timing on my part, entering healthcare at a time when the reimbursement mechanism was completely turned upside down. And then you fast forward to the 90s when HMOs really began to take hold as a new financing mechanism and as an effort to control utilization and care coordination in healthcare, and how we responded in those situations where we needed to think about how we coordinate care, how we make sure that the right resources were being applied at the right time in the right situation. And then, of course, we go to 2008, 2009, and we had the Great Recession. And that was just a cataclysmic event for really every organization on the globe and in the United States. Healthcare organizations certainly felt that. So the need to really focus on cost containment and how we revolutionized our infrastructures in healthcare was monumental. And then most recently, COVID-19, which was something that no one had a playbook on. No one had something on the shelf that we could dust off and say, well, this is how you respond during a 100-year pandemic. I think for all of us as leaders, it became an opportunity to think about how we managed the current state that was in front of us while still leading toward our future visions and continuing to activate the missions in our organization. And that's always the way that I tried to look at those situations. manage what we needed to manage currently, but continue to lead toward the future vision.
That's great. That is really a good perspective. So, tied to that, Paul, just as professional sports team have coaches for the starting lineup, the quarterback, the pitcher, whatever, your article shares the importance of having someone from outside perspective providing feedback and supporting learning. Why is that so important?
Yeah, I think as leaders, we are human beings first, and we are leading leaders second. And I think as human beings, we have a natural inclination to develop these internal biases that come with the breadth and depth of our personal and our leadership experience. We have blinders that we have on. That's just the reality that every leader and every human being faces. And I think when those blinders and those biases take hold, if we don't have the objective, unbiased perspective of somebody outside of our sphere of influence, those blinders and those biases may become hindrances to how we lead our organizations and how we fully activate the full potential of our missions. So that's why I think it's just critically important. And also the way we lead, particularly during those times when revolution is taking place that impacts healthcare, we need to make sure that the shadow that we cast to our leadership teams and in turn throughout the organizations are shadows that we want to have followed in the organization to ensure that in our case, the patients are receiving the best care and our team members are best equipped to deliver care and to support the patient family experience. So we need to make sure we have those outside perspectives, influences, and discernments about what is great about our leadership and what may be hindering the full potential of it.
Thank you very much for that answer, Paul. It speaks a lot about your experience in how careful you have to be to while still leading, allowing your team to be creative in moments such as COVID-19, right? Where you really need to unleash the creativity of every individual in the organization to come up with ideas, to respond, uh, to be able to apply solutions that, again, we don't have a script, we don't have a playbook for something like that. So it seems like we're just laying another stone in front of us to create the pathway, right? It's a really fine balance. Can you tell us about some of your experiences in situations like that, but also in times of maybe there is no disruption? Um, Tell us about an experience in receiving feedback from someone else during your career, from a coach, from an executive coach, from a mentor, from somebody else. And do you have any anecdotes that come to mind about feedback that maybe it wasn't that easy to hear in the beginning? Maybe it was hard to hear. How did you take it and how did you learn from it?
Yeah, that's a great question, Carlos. I'll give you two little anecdotes. One goes back quite a way in my career, and the other one is more contemporary. But I remember probably about 20 some years ago when I joined a prior organization that I was in. My boss at the time, the person who recruited me, I remember our first performance evaluation. And, I would say that I didn't get a lot of real-time feedback as a leader there. So most of the feedback came during the course of that once a year evaluation. But I remember this person telling me, he said, Paul, he said, you have the great ability to envision the future. You know where we need to go, and you know exactly how to get us there. And you have all the tools and traits strategically and operationally to make it happen. The opportunity that was presented to me, however, my blind spot was that not every single person in the organization, leader or otherwise, saw the same vision or had the same trajectory in mind as to how to achieve whatever vision they had in mind. So he encouraged me to take a pause, if you will, during the course of that leadership journey to reflect upon the need to develop the relationship capital around me so that others could understand where we're heading, why we're heading there, how we might get there, and most importantly, what role that individual could play in that journey, and perhaps adjusting my own mindset and different definition of where that vision would take us based upon the input that I was getting from others. So the moral of that story is that I was not listening to people the way I should be. I was charting a course and I was going to barrel through until we achieved that vision. And I thought it was the best vision out there. Not everyone saw it that way. And candidly, to hear that from a person I respected immensely was a bit of a gut punch because I had never heard it before. I had never heard it before. And I was about halfway through my leadership career at that time. And that attribute of my leadership was probably well ingrained up until that point. And it became one of the most compelling pieces of feedback that I've ever received. Now, fast forward, that was really something that I continued to be challenged by throughout my entire career. I wanted to move fast. I felt we had an obligation to significantly impact the lives of others. And even most recently at Children's Mercy, I occasionally suffered from that same dynamic, the need to not only recruit the best leaders that we could find to advance our vision and our mission, but to ensure that they were on board, their input was appreciated, respected, considered, and ultimately helped to contribute to that future state and to be more of an active listener as much as a doer and a change agent. And it's uncomfortable when you hear that feedback. When we evolve into these leadership roles, sometimes there's a little ego that comes with it, right? Not everyone may want to admit that, but that is the case. We have people telling us how great we are. We get invited into circles that we may not if we were not a leader. And sometimes we need a dose of humility, and that humility can be instilled through the feedback that we receive from others. And those are some instances that I can reflect on where it was hard to hear, but really important in the continued evolution of my leadership journey.
That's excellent. This connection that you're making to principles like leading with humility, it's not easy in the beginning to make that transition because you're used to give people direction, and people are seeking that direction for you. It's a system that you may think it works, right? I just need to tell somebody what to do. Those are their marching orders, and they go and execute, and the system works perfectly. But leading with humility is about understanding as a leader that you don't have all the answers.
Yeah.
That your role is just beyond giving direction to people. It's about developing them. It's about asking the questions that are going to make them think. But sometimes that feedback can be taken as maybe as failure. What am I doing as a leader? I thought that I was doing the right thing.
Yeah.
And am I failing? Why do you think that leaders sometimes relate feedback to failure?
Yeah, it's a great question, Carlos. I think some of it may relate to our own insecurities as human beings. Whether it's the pressure and the expectation that's put on us by our boards that we are responsible to, the communities we're responsible to, the patients, it could lead to insecurity and a need to ensure that, or a feeling that the best way for us to achieve those goals is to control as much as we can control. But I think the greatest lesson that I've learned in leadership is that true leadership transformation comes with letting go, empowerment and autonomy given to others who may be equally as capable of achieving organizational goals and achieving personal goals. When we release that rope and we give them enough autonomy and empowerment to succeed, as well as enabling the occasional failure that enables further growth, that's when we experience the true joy of leadership. And I think for many of us, me included, whether it's insecurities, whether it's the pressure from stakeholders that is put upon us, the pressures to ensure our organizations are achieving their goals and their metrics. All of those things can contribute to that characteristic that you described. Now, occasionally in people, egos take hold, and there's the occasional narcissist out there. Those are not perhaps the majority of those leaders that I've met in my career. But fundamentally, it's about vulnerability, allowing others to create a lens on your performance and how it's impacting the organization and its people. The humility that's needed. I always prided myself on I called it a basement to boardroom style. When I would see the environmental service techs in the hallway, I would tell them, this hallway looks incredible. And remember, you're not just creating a clean environment, you're creating a first impression for the patients and visitors that walk in the door. You're preventing infections from occurring. So I think the opportunity to learn humility and vulnerability is key, but that is an opposing force to the insecurities we all have as human beings and the occasional egos and narcissistic behavior that I've observed in my career. And I think those are some of the things we need to contend with.
Thank you.
So, Paul, you bring up a really good point. You talked about your personal experience with feedback as an opportunity to understand as a leader whether your actions are actually having the impact you intend. For example, you talked about needing to build a relationship. So this is, and you've really shared with us kind of a fundamental human nature, aspect of this. How do leaders create a real mindset shift organizationally to welcome feedback as opposed to, as Carlos said, looking at it as a report of failure?
Yeah, I think it's a great question, Peter. And I think there is an element of leadership that requires leaders to go out to where the work is being done. And in the lean philosophy and culture, we call that, of course, going to Gemba, going to where the place, where the work is being done, the place where it is being done. And when we do that, and we utilize a style that is not going out to that place where the work is being done and saying, this is not going well, this is what you need to do differently. It's using appreciative inquiry. It's asking curious questions. It's listening 80% of the time and perhaps talking 20% of the time. And it's really learning from those who are most engaged in where the systems and processes are at work, and therefore are most knowledgeable as to where the experiments can be conducted to improve those systems and processes. That is the opportunity. So really, it's going out and seeking that feedback from your leadership teams, from the team members who are working most closely in the trenches where the work is being done, and having that mindset that I don't know unless I go see. And when I go see, I need to seek to understand and not just judge what I observe. So I think those are some of the characteristics that can be employed.
Outstanding.
Thank you. Paul, in your article, you talk about the importance of the role of the executive coach. Can you, but also there's an element about misunderstanding of such role as well. It's not somebody that is just there to tell you what to do, right? Can you explain the difference between that role that you suggest and what others might perceive as that conventional thinking?
Yeah, absolutely. When we are leaders as coaches, I think the way we've been sort of born and bred within healthcare, what we've been taught in school and our graduate programs is we have a knowledge base that perhaps others don't have. Therefore, we should use that knowledge base and we should go and tell people what they can do to fix their systems, to improve their operations, and so forth. The role of the coach is completely different. It's to evoke awareness on the part of the client, the coachee, the other leader, as to what is enabling their leadership to be most effective, but even more importantly, to evoke their awareness of their blind spots and their opportunities for growth in how they lead. And it's by doing what we just talked about. It's by asking curious questions. but it's also by listening more than talking. And to ensure that that empowerment and that accountability is created with the client, with the leader, with the coachee. And it's not just the coach saying, this is what I've observed, this is what I think you should do. By asking questions and by doing that active listening, it is incredibly joyful to watch the client and the coachee come to their own conclusions, do the introspection, do the evaluation of their own leadership, and therefore create their own action plans for improvement. And by doing that in subtle ways as a coach, by asking questions, by listening, and by asking the curious questions, most often that person will come to their own conclusions as to what they can do differently and better, what they're doing well, create their own action plans. And then, of course, execution and accountability has to be ensured. It's a joy when it works, and it usually does if the coach takes on the role of curiosity versus inquisition and developing those action plans for the person.
Paul, one thing you discuss in your article is the personal experience of leading, being involved with two lean transformations. Not many people can say that. In the article, you make a reference to having a breakthrough. You realized you needed to shift from, as you just talked about, telling people what to do and solving problems to a different type of leadership. So, how did you come to that realization? What was the epiphany? How did coaching help you along that journey to get that understanding?
Yeah, there was a milestone moment in my career, and I'll name the organization because I think it was just a great moment. But when I was working at Nemours Children's Health System, I was at the Alfred I. DuPont Hospital for Children, and we were in the very early stages of adopting the Toyota management system as our approach to lean and therefore improving operations, eliminating waste in the organization. We had gone on 4 study trips to learn all about this philosophy and this culture, and with it, the role of coaching and feedback. And at that time, the medical director of our operating room came to me with a proposal to expand the number of preoperative rooms that we had up in our perioperative suite. And basically, the value proposition was volume was growing. We needed to reduce turnaround time between when the patient family arrived and when we got the child in the operating room. And it was about close to $1 million capital investment. So, fresh off of these learnings, I asked the medical director, who I had and still have great respect for. I said, we've all learned this new way of thinking. Let's experiment with it now. I'm going to ask you to take a few months to go back to use some of the tools and methodologies that we've just learned to look at our processes and systems to see what may be hindering them, and then come back in 3 months. And if the result of that indicates that we should still invest in the capital, knock walls down, build more space, which is a definition of waste, as you know, then we'll do it. But let's at least see if we can avoid that investment while still creating more value for the patients and for the staff. Fast forward about 3 months later, this physician came back to me and he said, Paul, not only do we not need to make this capital investment, we can exist with the number of pre-op rooms that we have available. We also believe that we can improve this process to a point where we can bring the kids and families in 45 minutes before their scheduled surgical time instead of 2 hours. And we may be able to even eliminate the surgical waiting room over time. That for me was just the milestone moment in my thinking about coaching, feedback, the approach to a daily management system using our lean tools. And they had me at hello in that conversation. It was an incredible moment. And since then, I've been a passionate advocate of the management systems that we are all working to create and nurture in our organizations across the country.
Wow, I love the Jerry Maguire reference in there. That was very nice. Thank you for that. By quick question, because we are creatures of habit. Why is it difficult for leaders to make that transition and not, a lot of times we've all seen it. they fall back into the old habits. And so, why does that happen?
Well, we've used a couple of sports and athlete analogies here today, but that muscle memory is important. If you don't continue to exercise not just the skills and the tools and the methods, but exercise the mindset of lean thinking and how you empower those who are most closely aligned with where the systems are at play, then you will lose that mindset and you will lose the skill set. It's not like riding a bike. It really isn't. It requires practice. It requires occasional failure. It requires experimentation, but you have to go back and do it and do it. Sometimes it's just too easy. If I would have said to that physician who came to me and said, here's my proposal, this is what we need to spend. Hey, it's in the budget, easy to say yes to. But the most important aspect of the mindset is to question with curiosity and to go back and to use the tools and the culture elements and the philosophies that we've learned and continue to exercise those muscles so they're always top of mind.
That's a good point. And just one side follow, you talk culturally, that means that culturally you experience that in your peers and coworkers every day. So it reinforces that habit and that muscle memory, as you said, but then develops it beyond that. So in the work at Catalysis, we support kind of tied to that, the organization, the support of the development of an organization of problem solvers. You, in particular, use the phrase that culturally, everyone, and that almost could be all caps, should be an improvement specialist. How can you support that philosophy system-wide?
Yeah, it's a great question. So at Children's Mercy, we kind of coined that term that all of our 8,000 team members we consider to be improvement specialists. I always wanted to get it on the ID badge of every team member. I was not successful in doing that, but that was my goal. But the way we continue to instill and nurture that mindset was to talk to our team members about it and to ensure that the culture of lean in our organization was constantly practiced, exercised, experimented with, and we utilized, the traditional PDCA cycle within that. So we would always, we were continuously doing rapid cycle experiments of change, going back and assessing the impact, measuring the things that we should measure, and then going back and tweaking those improvements and systems so that we created that evolution and that momentum of continuous improvement. But in order to do that most effectively, you have to engage those folks who are most closely in the middle of those systems and processes, who are experiencing the failures and the inefficiencies of those systems, and empowering them to help improvement. When you do that, it ties right back to culture. Then you are creating an organizational culture where all the team members are feeling valued. They feel valued, they feel a sense of purpose, they know that they are appreciated, and that momentum will continue and it will become a snowball rolling downhill in terms of how it improves the culture of an organization.
Thank you. Thank you for that, Paul. I believe you have mentioned also in the article, but also you have made a few references today that you think in a system, nothing is disparate, everything is connected. How can that be coached to an executive with significant responsibilities, or a C-suite leader that has a specific responsibilities?
Carlos, it's a mindset. I think my team members came to hate me because I would always say to them and say to the entire population of team members that nothing we do as an organization is disparate. Ultimately, everything that we do is connected, and it's connected to our mission, it's connected to our vision, it's connected to our strategic goals. So irrespective of the role you play in the organization, every single task you do during the day, or every program you help to build and improve or implement, or every high-level strategic goal, the first question you should ask yourself is, how does it ultimately connect with and align with the broader organizational goals and mission? And it's going back to the conversation. It requires practice. It requires exercising that mindset. It requires developing that muscle memory. And you're absolutely right. When you are an operator, when you are a nurse, when you are a financial counselor, you will tend to be magnetized to the task at hand that's in your job description. And we just had to continue to reinforce. They talk about saying something 7 times in 7 ways before it really begins to click into our mindset. Well, that's what we had to do, is to constantly remind ourselves and the other team members in the organization, because sometimes people would look at the need to be accountable to our budget as an action that, okay, the folks wearing the suits only care about the money. Well, no, the money is what is enabling us to fulfill the mission. It allows us to give you pay raises, to pay for your benefits, to replace and update equipment that is used on our patients, to upgrade our facilities, and to implement a strategic plan that will give us a competitive advantage, right? So it aligns with something that is much bigger, much broader, and much more complex than just trying to create a bottom line. So I think that's what's important. It's just continuing to speak to it and to gather the input of others in terms of how they're processing that.
You mentioned something that really piqued my attention, which is I think you said my team members came to hate me, because you kept saying that phrase, that nothing is disparate, right? And it really speaks to me about maybe a barrier where leaders that are transitioning to a different style of leadership, that don't want to be directive, that want to be more humble, that want to develop others. But when a barrier like this occurs, take a step back and say, oh, maybe I'm not doing it right. Maybe I should really rethink this whole thing. Do you have any comment around that? Like, how do you get over that hump, realizing that, yes, I am putting out there a little bit of friction, but it's a healthy amount of friction, right? It's a healthy amount of just helping to make them think, but at the same time, it might create a little bit of frustration. I remember when I was doing this work myself in Kaiser Permanente, sometimes I was coaching the executive leaders, and I was telling them, let's ask these types of questions. And on the other end of the table was the senior leader that was being coached, and that person left the session feeling like, well, I didn't get what I came here for, which is direction. I'm used to receive direction so I can go out and go and execute. On my end, the executive leader felt great. That was great. I feel awesome about myself. But in reality, there's friction created, right? How do you get over that hump?
Yeah, Carlos, it's such a great point. And first of all, I think what you're touching on is the value of coaching, having that external lens and perspective on how the organization and its people are experiencing you as a leader, right? And an element that, if the coach is doing their job, evokes the awareness in you as the leader, is the opportunity to, catalyze healthy debate in the organization. And there's a fine line between healthy debate and debate that can end up being destructive to the organization. And I've seen both sides of that. But when the leadership team, and when the shadow is cast beyond the leadership team, experiences the opportunity to debate a situation in a healthy way that preserves the values and the ethical principles and the guiding behaviors that are expected of leaders, when that can occur, you can see true transformation. And that perspective, I used to refer to it as 1 and 1 equaling 3 instead of 2. When you have the opportunity to hear the perspective of those around you and then reach consensus, maybe not unanimity, but at least consensus on the best approach going forward, oftentimes that can be something that is much better than what the individual thought might be the best approach. Now, it doesn't always work, and leaders oftentimes have to make decisions if you can't reach consensus. So clarity on where the decision made is very important. But all of those things become coachable moments because when you're living them, as you described, sometimes you may have blind spots on, and sometimes you may sense frustration or feel frustration where the team is heading. But a good coach will evoke that awareness on your part in terms of what tools, methods, and strategies you can employ to gain that perspective.
Thank you.
Paul, any closing thoughts you want to share with the listeners?
I think the closing thoughts for me is leadership is a journey, and any leader who is truly authentic will be able to authentically reflect not only upon their successes and their promotions, but the failures and the challenges that they had to encounter in that leadership journey. And for me personally, as I reflect back upon my career, I'm proud of what's been accomplished by the teams and organizations I've worked with. But my greatest learning was occurred from the failures and the challenges that I experienced and the coaching that I received that helped to open my eyes to what those opportunities were to better evolve my leadership, not only as a leader, as a human being. So the moral of the story is seek feedback, seek it often, listen to it. And one episode of feedback does not make a leadership journey. You constantly have to go back and seek it again and again and again. But when you do that, when you express that vulnerability, you will be able to transform as a leader, as a human being, and the performance of your organization and its people will rise up in that same boat.
Paul, thank you so much for joining us today. We're so excited to have you on the team. You sharing your thoughts on the benefits of external coaching or mentoring for healthcare executives. Thank you. Thank you.
My pleasure. Great to be with you, Peter and Carlos.
We appreciate you all listening. If you have any suggestions for us, want more info on this specific topic or other topics you'd like to hear, please just email us at events@createvalue.org. And Paul, having described the value of executive coaching, his recent article on this is at createvalue.org/executive-coaching under the resources section. As always, please take care of yourself.
Thank you for listening. Visit createvalue.org to learn more about how Catalysis can inspire you to accelerate change in your organization.